Emergency Medicine Day is a day that brings emergency care into perspective. And so celebrating this day brings different cadres together, brings the emergency medicine physicians, the nurses, the drivers of the ambulances, the paramedics and the emergency medicine teams. And so with the help of SEED Global Health, Ministry of Health and other organizations that are together here, we celebrate this important day for care as we bring policy into practice.
The World Health Organization has shown us that if we invest well in emergency care and we have a functional and responsive emergency care system, we can reduce death due to emergencies by 54%. And this is a good return on investment. So it is critical that the decision makers involving different ministries invest in this space. When you look at our annual health sector performance report, the top 10 causes of death or mortality are due to emergency conditions. So if you have a functional system and you reduce this by 54%, then you would have helped this country. You would have made people to survive. The road traffic injuries alone are taking away our productive young people. So if we have a responsive system, then we can save these people who are very critical for the development of the country. So today we appeal to all of you to pick interest and ensure that emergency care system is well built in this country.
SEED is a key player in emergency medical services in Uganda. SEED supports training of emergency physicians at 2 institutions currently, and over the years we've now have a combined graduate of almost 25 emergency physicians. Of course, we know these serve a population of over 46 million, but we try as much as possible now to create opportunities of building capacity. Beyond that, SEED has trained also other in-service healthcare workers through alternatives beyond structured university curricula, such as emergency medical services, ECHO, such as CPC, and other simulations that we currently conduct all over the country. So in terms of like the overall SEED contribution towards emergency medical services, it's majorly on health workforce development. Our target is to have 120 emergency physicians by 2030, and it can only be collaboration of various stakeholders that will lead us to that. It is actually difficult for an institution alone to train emergency medicine physicians or doctors. I could give an example. SEED supports strongly the emergency medicine program in Makerere University. So the partnership between Makerere University, SEED Global Health, and Ministry of Health Emergency Medical Services Department collaboratively has actually led to the graduation of a number of emergency physicians. SEED places educators at these institutions. As part of their contributions, the university ensures that the curriculum is available and the systems are available for people to graduate. And then Ministry of Health absorbs the emergency medicine doctors. So that's the kind of like the collaboration we actually envision and build.
But we say the day today is for the continuum of emergency care. With the perspective of physicians being trained, they could not work alone. And so the emergency medicine teams are producing the emergency medicine technicians. And also we are training more nurses with even basic certificates like advanced life support, advanced trauma life support, international trauma life support. And this brings the continuum of care together so that we can prepare these patients from the scene, for instance, if it's an accident, through the ambulance, and they reach the hospital safely to get the urgent care they need.
It was an important day for us to come together and now reflect on the journey we've moved over the years and where we're actually heading to.
We are on the right path because we came from zero. We are now having a system which just needs to be beefed up, and we are able to provide the care we desire in the country.
Emergency medicine is ever growing. Just like a baby is born, you start by raising your head, crawling, eventually walking and running. We have taken off. We have started walking. I dream of a day. My vision is when we're having over 250 emergency medicine physicians trained in Uganda and occupying all the hospitals in the country.